start with, have you been able to hire an attorney to represent you yet, ma'am?
How am I supposed to hire an attorney if I'm in here?
An unusual day in court for two defendants accused in a dog dumping case that drew reaction from across Pinellas County. Good evening, I'm Keith Kate.
I'm Jennifer Lee. Thank you for joining us. People gathered inside and outside the courthouse calling for justice for the dogs that were abandoned at a Largo park. News Channel 8's Georgia MacArthur joins us now live from outside the courthouse with the story. Georgia.
Yeah, Jen and Keith, justice for Frosty. That was the message on supporters' shirts. Frosty was one of the dogs that was abandoned last month that has now since died. And there was some unusual moments from the courtroom that some animal advocates say they didn't expect. Outside the Pinellas County Courthouse, people rallying for accountability in a case involving a dozen dogs found dumped at a Largo park. Animal advocates pushing for Dexter's Law, a new law that provides harsher penalties for aggravated animal cruelty cases, making it more likely that individuals committing these crimes will go to prison.
We're hoping that they get the max penalty to set a precedent using Dexter's Law, because that's what needs to happen for change and to get animal rights.
Marianne and Fred Gamble are now facing felony animal cruelty charges. Last month, 12 Shiba Inu dogs were all found dumped in a plastic bin at the park. According to police, both individuals were illegally breeding dogs and had knowledge that some of the puppies in their care were sick and died after being sold. Last week, police were able to rescue 4 additional dogs from the home.
I'm going to add as a condition of any bonding that you may not have any contact with the animals. No dogs, no cats, no well-trained attack falcons, no gerbils, no ferrets, no nothing, all right? Stay away from the manatees.
Marianne, who went before a judge first, appeared to not take the felony charges serious.
No squirrels?
No squirrels, no dumpster pandas, nothing, all right? If it's not human, you're not having contact.
One of the dogs, Frosty, faced significant injuries before passing away. Co-defendant Fred Gamble also appeared facing 5 new counts of animal cruelty.
Can I get a lower bond, because this, my family cannot afford this at all.
Well,
and I'm a working guy.
Well, despite being a working guy, a judge did set both defendants at a bond, a $5,000 bond for each of the 17 felony counts. Keith.
And Georgia, unfortunately, it's my understanding not all of these dogs survived.
Yeah, so investigators say when they did go inside the home, they were able to rescue an additional 5 dogs from the home. But later on, investigators say the couple admitted to burying some of the dogs that were sick on the property in their backyard. So investigators believe there could be additional animal cruelty charges.
Georgia MacArthur reporting live for us in Pinellas County. Thank you.
Well, retired first responders in Hernando County tonight say the city of Brooksville failed them. City Council is discussing cutting the pensions for about 40 firefighters. News Channel 8's Ryan Arbogast is live for us at Brooksville City Hall. Ryan, why would they cut pensions? What's going on here?
Jen, City Council says this all started back in October of last year when the Brooksville Fire Department was dissolved due to budget cuts, and most of those fires transferred over to Hernando County Fire Rescue. Now, the retired firefighters we talked to today say they're anxious, they're scared, and more than anything else, they're disgusted.
I lost faith here tonight. I won't be back.
Former Brooksville Fire Chief James Atkins served this city for 3 decades.
It's going to hurt financially. And I left my wife. She don't even feel like coming to this meeting. She was crying. But it's a sad situation. I lost a lot of people in the fire department. They passed away. Went to a lot of funerals. I did a lot of stuff.
Monday, he and other retired first responders petitioning City Council, asking them not to go through with a proposal to cut their pension.
This is not the way to treat your firemen.
City leaders saying the reason is all numbers. They're behind on the payments.
It is a $3.7 million buyout to fully fund the pension. The pension is not fully funded. I believe it's, don't quote me on the exact number, it's either 85 to 88% funded right now.
Council vows that these folks will get their money, but an independent commission will determine how the funds are released, aka a lump sum or an annuity.
I'm 77 years old. I'm too old to go out and get another job. I'm living on my Social Security and my fire retirement.
About 20 firefighters are retired and on the pension plan right now. Another 20 who are buying in still work for their replacements. Hernando County Fire Rescue.
When you work for somebody and you're promised whatever benefit, then that benefit becomes questionable or it's not there. It hurts.
Jen, Keith, it's important to note that this is still a proposal right now, but there is a vote scheduled on the books for the end of the month. That will be right here at City Council, January 26th at 7 o'clock. We're live in Hernando County tonight. Ryan Arbogast, 8 on your side.
A Tampa couple is handling the loss of their newborn by giving life to others. Mother tells us she carried her untreatable daughter to term so that she could save other parents from going through something similar. 8 on your side's Eden Hodges sat down with him to hear the story.
The parents tell me nothing could have prepared them to learn that their unborn baby wouldn't have a chance at life. But they say they found a way to give her a lasting legacy despite her circumstances. 14 weeks into her pregnancy, Catherine Morningway and Andrew Ford's dreams of their baby girl were shattered.
I don't think we really ever got over it. You know, it's more so kind of accepting that it's out of your control.
Doctors told them at an ultrasound that their daughter had a rare health condition and would only live a few hours with the help of machines.
Started getting excited and, you know, then obviously heard that news and discovered that. And pretty devastating and surprising. Didn't know what to do for the longest time.
They gave them the option to terminate or carry the baby to term. Morningway tells me that an episode of Grey's Anatomy gave her the idea that Haven's life, however short it may be, could give life to others through organ donation.
That's really the biggest reason is we want her death to mean something.
After the delivery, Andrew and Catherine held Haven for a few short hours, showing her all the love they'd felt for her since the beginning.
We got to see her and her little feet and hands, and she really seemed like she had, you know, quite a personality. It was really special the time that we got. I know she's out there,
but in our hearts and with us at the same time.
Since sharing their story, they've realized that their sacrifice has impacted more than just the babies in need of critical organs.
I've had a lot of strangers reach out to me and say some really beautiful things, and people donate life in her honor, and I feel like it's really making a difference.
Health professionals at HCA Brandon tell me they held their very first honor walk for a newborn, and they tell me they're the first hospital in the state to have successfully retrieved a partial heart transplant, which will go to babies to help them not have to go through multiple open heart surgeries. In Tampa, I'm Eden Hodges, 8 on your side.
Despite many different attempts and efforts, that the limb did continue to steadily grow as she grew.
A 14-year-old girl suffering from a rare condition is back home tonight after a grueling 17-hour surgery.
She underwent the surgery to remove a tumor that caused her leg to grow larger than the rest of her body. News Channel 8's Jeff Patterson joins us live from Johns Hopkins All Children's Hospital in St. Petersburg with this remarkable story. Jeff.
Good evening, Jen and Keith. Well, this story is remarkable in many different ways. First off, doctors here at Johns Hopkins All Children's Hospital tell us that the condition that 14-year-old Jasmine suffered from is very, very rare, and the operation that she had to endure was very difficult. But tonight, she is going home with a smile on her face. However, I do have to caution you that one of the photos that you are about to see may be a little difficult to look at, but keep in mind it was much more difficult for Jasmine to live with it. 14-year-old Jasmine Ramirez rolled down the hall of All Children's Hospital today to the applause and smiles of the nurses and staff that have helped her for months. Then she stood and rang the bell, letting everyone know she's ready to go home. Jasmine says ringing that bell meant everything to her.
Really happy that I'm going home now, and I'm really excited to see my dog, my sisters, and all of my family.
Her condition began at the age of 2 when her leg began to grow abnormally large. Over the years, she was treated with antibiotics and other drugs and surgeries, 17 separate surgeries to help.
It's not just a few months, it has been a journey.
Jasmine's father says they tried everything.
My wife and we try to do everything and anything out there possible to keep her leg. And we had come to the point where it was her life and not her leg anymore.
Her doctor says her condition is extremely rare.
It is in the top 10 in my career of almost 30 years of searching, but we haven't given up, and we are going to figure it out, and then we are going to call it Jasmine's gene.
Jasmine says she didn't expect to go through all of this and didn't expect all of the attention. She's just happy to begin the process of recovery.
I was not expecting it, but you know, sometimes there's some surprises in your life that can happen, and this was one of the surprises in my life that I didn't know that was going to happen.
That kid has a great attitude. Now, when doctors removed her leg and the tumor that had become part of her body, it all weighed more than 170 pounds. But again, tonight, Jasmine is on her way home smiling. Live in St. Petersburg, Jeff Patterson, 8 on your side.
Today, the CDC lowered the number of vaccine recommendations for children, and Bay Area doctors are reacting to those changes. News Channel 8's Marilyn Parker live in Tampa tonight with more on the story. And Marilyn, how many vaccines are we talking about the CDC recommending now?
Josh, it went from 17 to 11 for children. The assessment by the CDC talked about public trust and the health that they have in the healthcare system. And also, it mentions how there was a lot of concerns going back to the COVID-19 pandemic. And they also mentioned how there is just a lot of falling childhood vaccine rates that they wanted to make sure was mentioned when they put all of this together. But ultimately, the doctors I spoke with say that there is a big risk that they want everyone, not just parents, to be aware of.
I think this is extremely dangerous. There has not been a case made to eliminate these vaccines.
These 11 vaccines are still being recommended by the CDC for children. They include measles, mumps, HPV, and chickenpox. Bay Area doctors say they can't get behind this reduction.
And to actually say we're going to roll back the recommendations for these vaccines, and at a time where we're seeing an increase in vaccine preventable diseases, it's just nonsensical.
The Department of Health and Human Services Secretary Robert F. Kennedy Jr. says this decision protects children, respects families, and rebuilds trust in public health. Officials will recommend immunization for high-risk groups. President Donald Trump ordered health officials to review international best practices. Denmark was used in the study. One USF professor says the U.S. is not comparable.
We're talking about a country that has universal health care, with the United States patchwork of health care and a high number of population that has no health care whatsoever.
She asks, where is the risk analysis or the expert opinions linked to these recommendations? HHS says they recognize the need for long-term observational studies to better characterize vaccine benefits, risks, and outcomes. The Florida chapter of the American Academy of Pediatrics called the decrease tragic.
There are going to be children who will not be able to attend school, our big tourist areas. And there are going to be tourists who are not going to want to come to our state because they're afraid they're going to get diseases that they could have prevented.
Who should families listen to?
As a pediatrician, many of us have been doing this for a long time, and we know your family and your child much better than a general recommendation.
All immunizations previously and currently recommended by the CDC will be fully covered by federal insurance programs. Also, the CDC will publish the child vaccine schedule and continue to monitor infectious diseases. We're live in Tampa tonight. Marilyn Parker, 8 on your side.
A Galen nursing student is getting a big kudos from her professors after she saved someone's life between classes.
The student tells us she used her book smarts to step up and help a man who only had a few minutes left. News Channel 8's Eden Hodges joins us live from outside Galen College of Nursing with the story in the student's own words. Eden.
Yeah, Jen, that student told me that she's always been inspired by those people who will step up in a crisis. And she said that's actually what led her to pursue nursing. But what surprised her was how soon she would become one of those people herself.
When you talk about proud, it's
It's like way beyond that.
Nursing student Leslie Arroyo is making high marks with her professors for something they tell me is more impressive than a good grade point average.
Not always do we, as faculty or as staff, get that immediate reinforcement that what we're doing matters.
Arroyo was on her way back to class from lunch when she got stuck in traffic because someone was in the road.
That man was like literally just lying there, and I was like, is he dead? And I was like, do I like get off? Like, do I just drive and then like tell my teachers?
But Arroyo says she knew that time was of the essence.
I was scared, but that's what motivated me the most. Checking
out her patient, Arroyo recognized signs of an overdose. So she used the Narcan that she had been saving in her car just in case, and ultimately saved the man's life.
I felt very happy that I was able to help. Honestly, that was the highlight of my last semester.
Arroyo says she gained some confidence through the experience, and she's learned never to underestimate what a difference her basic training can make.
Some might have been afraid, and it's like somebody else will take care of that patient. She was the lifesaver, and she did not consider herself. As a faculty member, that's success for us.
So Arroyo's professor, who we just heard from, actually tells me that she's one of the quiet ones in class. But that professor tells me that this is one of those things that they try to really drill into their students, that whenever there's a crisis, they are the ones that have to step up. In St. Petersburg, I'm Eden Hodges, 8 on your side.